So today I would like to start by talking about something in history that actually really interested me. Did you know that the first open heart surgery actually wasn't done until the 1900s? I mean, that may not be surprising because it's actually a pretty advanced thing to do. But even back then when they performed it, it started out going horribly. Survival rate was extremely low, and if it somehow worked, you would be in a bed for weeks. I mean, as we progressed forward in time now, our surgeries and procedures, they've gotten a lot better than they used to be. But still, we're stuck in a time when to perform an open heart surgery, you have to literally pull open someone's chest cavity like a fillet and then dig into the heart, one of the most vital organs to the body and most delicate organs. And then you're left with someone recovering for about 6 to 8 weeks in a hospital. And so that brings me to today. And today I'd like to talk to you about the Hansen Medical Company. I got to speak with one of their employees who gave me a good overview of this company. In particular, I'd like to talk how this company is taking cardiovascular surgery and moving it to a new level. They've taken it to a point now of non-invasive. And by that, I mean a robot actually controlled by a surgeon goes into the body and is capable of performing the same surgery as before, but with much less damage to the body, which in turn leads to a lot less time in the hospital. So in particular, I would like to focus on the 3 main elements of this organization. I would also like to focus on some of the major benefits from this non-invasive surgery, as well as I would also like to focus on the future of not only this company, but in general the entire field. So the first thing I'd like to focus on is one of the main components of this company. And one of the first ones is the actual engineering of this product. Now I won't go into major detail because it's quite complicated. One of their major things they've brought to the table that other industries have not been capable of doing is this new look at the catheter. And we've all heard catheter before, you know, if you're sick in a hospital bed and can't pee, it's this tube that helps you pee. I mean, it's not pleasant sounding, but I mean, it's very important. What they've done with the catheter is taken it to a new level of movement. It used to be that this catheter was also used to go up veins and look into the heart, and this was done manually by a doctor. Now they've been able to actually take that same thing and attach it to a robot, and which gives you a lot more stability and allows the surgeon a lot more control to move it into the body and look around. So the next element I would like to then focus on are sales of this actual machine. The first component of these sales is selling the machine itself, which is actually extremely expensive, or rather expensive, at least initially. It's a few $1,000,000 for one of these machines, but they can pay off down the line by doing more surgeries more effectively. And the next component of this is not only selling the machine, but then the parts for it. The parts are extremely important because you can't use the same parts again and again. It would be like using the same needle again and again. It's just unsanitary. And this is where I actually got to speak with an individual, and that is his primary focus in this company. He works on, after the machine's actually sold, he talks to the organization of the hospital and helps them with not only training their employees, because that's a major component of actually using this machine, but also with replacing the things that they have there, because like I said before, you need to replace these parts. So with that included, I'd also like to then focus on some of the primary benefits of this type of machine. So like I said before, it offers a stable platform for surgeons to work in the body. Before, it's kind of like if you were trying to navigate a catheter into a body, it's like trying to take a detour on the highway with an old GPS. Like it's going to be a tough time. You have a major layout of what's going on, but you're not sure if you're actually going to get there the right way. So surgeons are coming in all the way on the femoral vein. Say this is an open heart surgery, a surgery they want to enter the heart, and they have to find their entire way up. This machine, on the other hand, allows you to actually go out of the room and look through kind of a visual imaging of the body's circulatory system and find where you need to go. And also with a ton more movement capability compared to just the by hand. Now another one that I thought was really interesting, one of these benefits, is that surgeons before had to deal with a major risk of actual X-rays giving them too much radiation. Because when you're in that room, you have to wear a giant lead vest that weighs about 40 to 50 pounds, which not only weighs you down, makes you sweaty, you lose some dexterity as well. But also, once these surgeons get in their late 50s or 60s, they have an extremely high chance of getting cancer, which many times they're helping to fight cancer or many other diseases. So it's kind of counterintuitive. Well, this machine allows you to go into a completely different room than where all this radiation is, and work on it from sitting down in a chair instead of standing up with heavy lead vest on, sweating over this patient. So it's many benefits to it. Another one of these major benefits is to the hospital itself, because hospitals now don't get paid for how long patients are there. They get paid for the procedure, and then you got to get them out as quick as possible. I mean, it's sad to say, but that's what insurance companies want now. So a hospital obviously wants to get you in and out, healthy of course, as quick as possible. And that's one of the big things this machine brings to the table. Like I mentioned before, surgeries today, the recovery time is several weeks usually for open heart surgery. If you think about it, you're having your whole chest pulled open and all of your muscles cut to get there. It's pretty gruesome surgery, but I mean, it works nowadays. But this non-invasive surgery, they can get you out in days. You will be functioning again in days. Because if you think of it, the cuts they have to make are so much smaller. They may make 2 cuts on your side, come in, fix the problem, and never have to open your chest. And then think of this also, if it's beneficial to the hospital, it's also beneficial for the patient, because I don't know many people that actually enjoy sitting in a hospital bed for 5 to 6 weeks in pain, maybe on morphine. I mean, maybe if they like the morphine, but besides that, I don't see a good reason. So if you're a patient, you also want this. You want your doctor to get you in and out with as little damage as possible. If I had an open heart surgery and then I could go to, say, your son's wedding, or you could go to watch a football game the next week, wouldn't that just be, that'd be very nice to do. Now, to focus on that, I also want to then move to the potential future of this company. Non-invasive surgeries are not only for heart, they're actually moving for everything. Heart's just one of the major focuses of this organization and a lot of others, because the main thing that people are dying from in this country is cardiac-related diseases, whether that's heart attacks, whether that's just issues with the heart over time. And these types of machines can perform the same tasks as surgeons cutting into you, but in less time and cause much less damage, saving hospital money and making patients much, much happier. I mean, I was told by the person I interviewed that they had a guy who was originally doing 20 surgeries a year, which is actually pretty good for open heart surgeries. And after he adapted this machine, got his training, he was doing over 100 a year. And open heart surgeries can get a hospital generally around $100,000 per that one surgery. So imagine going by 20 times 100 to 100 times $100,000. That change in cost is just wild to think about. So today, in conclusion, I wanted to talk to you about, of course, the Hansen company and how the 3 components of this company, what are the major benefits and the future that I can see for this organization and for the entire industry. So I think it would be great to get out of the hospital in 1 to 2 days, and I think that's moving for about any type of procedure you may have. They can apply this to surgery on the brain, they can apply it to surgery on kidneys, anything. It's just whoever comes out with the next more specialized thing for the right part. And that's where we're going to move today as far as I can see. It's just a matter of getting people to want to get on board with this new thing and decide that, you know what, my old system, although I know it well, I need to be able to make the change. So I'd like to thank you today for listening to the Hansen Corporation, and I'd like to hope that all of you kind of look into the future of this, as this non-invasive surgery, I feel, will drastically grow. Thank you.